From the Toronto Star, I'm Reggie Mudler, and this matters. The variants of concern are running amok throughout Ontario. Cases caused by the variants account for more than 70% of those in Ontario and give a snapshot of how COVID-19 is mutating and changing. With names like the B117, aka the UK variant, or the P1, which is known as the Brazilian variant, it is the former that accounts for the majority of cases in the province. There is currently a race going on between the variants and vaccinations, and it's a wait-and-see process to see if any other mutations, like the emerging variant of interest from India, may arise and prolong this pandemic. Or will this disease become endemic? And will we have to get used to this illness becoming like the flu, and just expect this virus to continue to mutate over time? Ashleigh Tuite is an infectious disease epidemiologist, mathematical modeler, and assistant professor at the University of Toronto. She joins us to discuss where the variants of concern are right now and what to watch in this third wave and beyond. Dr. Tuite, thank you so much for being with us today.
Thanks for having me.
One of the reasons I wanted to talk to you a little while ago is that one of the interviews that we had probably about a month and a half ago said that there's basically sort of two pandemics going on. There's sort of original COVID and now the variants. Obviously, Ontario has been hit very, very hard by these variants of concern. And I want to get into that specifically, but I think we should really just start right at the beginning because there's been a lot of scary news about all these sort of things, and we should always start with the basics. Can you explain to us what the difference between a variant of concern is and a variant of interest?
Sure. And if it's okay, I may take a step back even further than that and talk about mutations, because that's really where this all starts. So, viruses have genetic material, and their genetic material is RNA. So people probably know about DNA. That's what makes up our human genome. Viruses are made up of RNA. And when viruses make copies of themselves, they constantly make mistakes, and those are called mutations. And most of the time, those mutations don't really make a big difference. So it's just sort of the natural process of how they replicate, and it happens. Some of these mutations do matter, though, and some of them will make a virus what we would call more fit. So basically, they have some sort of competitive advantage. So something that changes in their genetic material that makes them either spread more readily, or they're able to escape our immune systems more easily. And so those sorts of changes are what we're worried about. And those are the sorts of things that we're seeing in these variants that we are all talking about all the time. So when we talk about variants, really what we're talking about are changes in the genetic material of the virus. And not all of these variants are variants of concern. But I guess the distinction that we want to talk about first is the difference between a variant of interest and a variant of concern. And really what it is, it's because these mutations and these variants are arising all the time, we're monitoring them. And usually when we first identify them, we don't know if the changes that we're seeing in their genetic material confer some sort of advantage to them or not. And so when we have a variant of interest, it basically means that we've picked something up in their genetic material that's similar to a change that we've seen already. And we know that those changes are associated with increased transmissibility or causing more severe illness. And so they're variants of interest because we haven't quite characterized them yet, but we have reason to be worried. And a variant of interest can graduate into being a variant of concern once we have evidence that those changes that we're seeing have actually translated into them having different properties that differentiate them from the original variants. And so, that's the case with the one that I think everyone's most familiar with is B117, which is the variant that's most common in Ontario that was first identified in the United Kingdom. And that particular variant, started off as a variant of interest. And as we characterized it more, we realized that it is more transmissible and that it does seem to cause more severe disease. So it does tend to have in people who are infected with that, they seem to have an increased risk of ending up in hospital or dying if they're infected. So that's really the sort of pathway that a variant can take. And so the variants of concern are really just, a subset of variants that have properties that make them concerning.
How are we tracking these? Obviously, right now, the variants of concern that we are aware of, there's the numbers, and of course, this is how we know them from their places. There's the UK, the South African, the Brazilian, and then I believe the Indian one is still considered a variant of interest, correct? So how are we tracking these things right now?
So the way that we do that is we look at their genetic material. So what we can do, and I'm not talking about myself, but scientists can do in the lab is they can basically look at the genetic code and look at the changes that are happening over time. And so that's called sequencing. And that's the best tool that we have for understanding what particular variant a person is infected with. So if you're infected, you do your lab test, we get a sample from you. We first of all screen to see if you're infected with COVID-19. And if you are, we can do additional analyses to try and figure out what particular variant do you have in terms of what's infecting you. The sequencing is actually pretty labor intensive. And the challenge is that, our laboratories at this point are busy. There are a lot of infections. And if you imagine if we want to do this sort of really in-depth analysis on all of these genomes from all of these viruses, it's a lot of work. So we also have the ability to screen. And that's really how we first realized that we were having the B117 variant in Ontario, is that when you do the initial screening test, one of the screening tests was coming up negative for people who had this particular variant. And so that was a clue. And it's basically a screening test that we can use now to look for these particular genes that are changed in people who have these variants. And then, once we see these signals that suggest that, the virus that we've isolated from this person doesn't look like the original strains, then we can go on and do this more in-depth characterization.
Looking at some of the most recent numbers, where are we at right now? I mean, particularly in Ontario, I believe it's that UK variant that is by far sort of the most popular right now. Is that fair to say?
Yeah. So in Ontario, at this point, more than 90% of all infections that we've characterized are infections with a variant of concern. And the most common one is the B117, which is the UK variant. But we do also see infections with the other really common ones are P1, which was first identified in Brazil, and then the B1351, which was first identified in South Africa. But by far the most common at this point in time is B117.
One of the reasons I want to talk to you is that last week there was announced that Genome Canada has announced this new portal in sort of tracking these variants of concern. How is that different from before? And are you seeing the results of that right now? Are we seeing where these variants are right now?
Yeah, so I think what really the difference is that this is a large scale initiative. So I was talking about, the public health labs are pretty overwhelmed right now. So this is really a way to scale that up and get the results back more quickly. And the idea here is that, once we know that we have variants of interest or variants of concern, we can set up special sort of more rapid tests to screen for them. Ideally, we want to have a really good picture of what's going on in the world. And similarly, within Canada, we want to know, what does the landscape look like and how is it changing? And can we pick up these new or emerging variants before they become super common? And so the way that you do that is you just want to do more sequencing and you want to have those results back quickly so that you can act on them. Getting a result back, a month or two into the future is, still useful information. But if you want to have something that you can act on today, having that information today is more valuable. So that's really, I think the reasoning behind investing in this sort of technology and that sort of information is that it really allows us to have a much clearer view of what's going on today rather than basically waiting for either other countries to tell us that they're picking up interesting and new variants or waiting, until we clear the backlog of all of the samples that are currently in the pipeline.
Has this shown us anything interesting so far about where the variants are occurring across the country?
I actually don't know the answer to that question. I think probably, the most interesting thing that we've seen in Canada is that, overall, the B117 variant is the most common. But in British Columbia, they've experienced a different sort of emergence in the sense that they have a lot of P1. So that was the one that was first identified in Brazil. And, in terms of trying to understand why that happened, there's a little bit of forensics involved in terms of, looking at the sequencing. You can get a sense of, how things spread and, how quickly they're spreading. And, that really seems to have been related to the fact that for whatever reason, there was a case or several cases in Whistler, and that just resulted in a large outbreak. And so part of the thing with these variants is that, we talked about how they have characteristics that give them an advantage that let them either spread more readily or cause more severe disease. But there's also an element of luck there. in the sense that, if P1 gets introduced into a really rural community where there's not a lot of opportunities for it to spread, it could get introduced and go away and we would never see it. Whereas if you drop that same variant into a really busy resort town and it happens to spread, and then those people go back home to their communities and, there's onward spread, that can result in this pretty rapid growth of that particular variant.
We'll be right back. Doug Ford, the Premier of Ontario, was recently talking about the variants. And even though they're here, he was talking a lot about shutting down the borders. What did you think about some of his comments?
I mean, I actually don't disagree with him. I think the borders are really important. I think, we basically have two ways to control the variants. One is at the borders, and the other is by reducing spread in our communities. So the way that these variants happen is the virus has to make copies of itself. So, as long as we have uncontrolled spread anywhere in the world, every infection is an opportunity for a scarier or a more transmissible variant to emerge. And so if we have strong border controls, the advantage of that is that whenever anybody's coming into the country, ideally we can test them. And if they're positive, get a sense of, what variant they're infected with. And ideally, have strong quarantines in place so that a person doesn't go on to infect other people. The situation in Ontario and in much of Canada is such that the variants are here. So, shutting the borders now isn't going to reverse what's happened with B117 or B1351 or P1. They're here. And we need to accept that. And we also need to do what we can within our own borders to try and prevent their spread. And the other piece to this is that, similar to the rest of the world, where if you have uncontrolled spread, you have more opportunities for new variants to emerge. The same applies to us domestically. So having 4,000 cases a day means that, each of those infections has the potential to result in a variant of the virus that has characteristics that are bad. So reducing transmission, it's not an either or. We really need to have a strong focus on the borders, but we also need to be really concerned about what's happening in our own backyard.
I want to sort of change hats here because I know you're a mathematical modeler of these sort of diseases as well. There's been lots of criticism about how some of these provinces have handled this. However, I will say that it seems like the Ontario's modeling has been fairly accurate. There was an update on the weekend. What did you think about it? And I think one of the things that they said is they were hoping that the third wave may have crested here. Can we take some hope in that?
I think we can take hope. It really does look like we've reached the peak of the third wave. I think, though, what we need to do is, I think it's important to balance hope with realism. And, I think it's really important to remember that we're still at really high numbers of cases. Those case numbers are not declining very rapidly. So we're sort of stuck between 3,000 and 4,000 today. And, to really get this under control and to get our hospitals back under control, we would like to see really rapid decline. So, I don't think we're in a situation right now where, we're continuing to see uncontrolled exponential growth, but we're also not in a period where I think I at least feel comfortable sort of, breathing and say, ooh, we escaped that and everything is okay. We're sort of in this period of watchful waiting where, we're going to continue to see the effects of this third wave on our hospitals for the foreseeable future. And, I think we need to be thinking more about what we can do to cause that epidemic curve to decline more quickly. I think we've not done as much as we should have. I think a lot of the effect that we're seeing in terms of that decline in cases reflects the fact that we've closed schools. To be perfectly honest, I think that the previous two waves, we've seen it around the world, that closing schools does have an effect on transmission. And so I think that's part of the reason that we saw what looks like the peak of the third wave and that subsequent decline. But I think we need to really be focused on continuing to have public health measures in place and continuing to push our government to make sure that we don't sort of let up too quickly. I think there's a desire to be done with this. And I get it. I want this to be gone like everybody else. And, we have vaccines, and the vaccines are contributing to this as well. They are helping us in terms of, hopefully getting into the arms of people living in our most affected neighborhoods. So, we have the combination of vaccines and public health measures. And, I do think there's reason to be hopeful, but also reason to be realistic and pragmatic and understand that, we're not going to wake up next week and this is gone.
You mentioned the vaccines. There's a lot of talk about how many we're going to have this month. Is this basically a race between the vaccines and the variants?
I actually don't think it's a race. I think it's a game of strategy in the sense that, we're never going to out-vaccinate the virus, but we need to be smart about it. And, if we're smart and strategic, we can, ultimately win this. But it's not like we out-vaccinate when we cross the finish line and this is done. Given the variants of concern, given the fact that, we have reason to be worried about variants emerging for which the vaccines are less effective, we need to be smart about this. And so I think over the next month or two, we're going to start seeing the effect of vaccines. But I think we need to understand that this is a bit of a long game in the sense that, not to give the virus human characteristics, but, we've seen this, over the past year and a half, that it throws us curveballs. We know that it mutates and it changes, and that, we're probably going to have to deal with, some curveballs in the future as well. I think what we're doing right now in terms of vaccination is spot on, given the constraints that we have in terms of the supply, the fact that we're focusing on hotspot neighborhoods, the fact that we're really getting in and trying to get this into the arms of people who are most affected, and also into the arms of people who, once they're vaccinated, will basically have indirect benefits as well to the rest of the population. We're definitely headed in the right direction.
I mean, we should also be very clear, despite these variants being more transmissible or severe, it's the same public health measures to basically protect yourself from them, right? Masking, social distancing, staying at home, right?
Exactly. Yeah. You don't need to change your behaviors. You just need to be better about it. If you're wearing your mask, then wear your mask. And it's, ideally wear a well-fitting mask with good filtration. And, really remember as much as possible, take it outside. If you're able to, if you're meeting up with someone, first of all, if they're not in your household, you shouldn't be meeting with them indoors. But, you can meet up with them outdoors. Remember to keep distance. Remember to wear masks if you're not able to keep your distance. It's not anything different. It's just we have to be a little bit better because the variants are more transmissible.
I think there has been a lot of scaremongering about this. And you did also mention the fact that this disease likes to throw us curveballs. There's some talk that COVID-19 could become endemic, something like the flu that's going to be around. So we're going to be seeing, do you envision us seeing variants for years coming for this?
I mean, based on what we've seen over the last year and a half, I think it's likely, but I don't think it's a reason to be scared. I think, at this point, we have vaccines and we have the ability to update our vaccines. So if we start seeing variants that are less responsive to the vaccines, we can change them and we can update them. I do think that COVID is with us for the long run. I do think it's going to become endemic. But, the thing that's wonderful with the vaccines is that it can be here, but as long as we're vaccinated, and particularly as long as we vaccinate people who are, most likely to have severe outcomes, it becomes a much less scary disease. You can become infected, but if you're not ending up in hospital or dying from it, it becomes just another coronavirus or just another cold virus. But, that's with the help of the vaccines and assuming that, we're able to update our vaccines and keep up with what's happening in terms of evolution of the virus. But, that's what we do with the flu. We update the flu vaccine every year because the flu changes. It's not without precedent.
Dr. Tuite, this has been fantastic for us. I really, really want to thank you for your time for giving some clarity about these variants of concerns. Thank you so much for your time today.
Yeah, you're very welcome.
Ashleigh Tuite is an infectious disease epidemiologist, mathematical modeler, and assistant professor at the University of Toronto. That's it for today. Thanks so much for joining us. This Matters is hosted and produced by me, Rajin Budler, Adrian Chung, and Saba Etisas. Produced and mixed by Sean Pattenden, and our director of programming is JP Fozo. Our show theme music is by So Called, and our episode music is by Mike DeAngelis. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.